My real pleasure and honor to bring up to the podium a lady named Becky Vaughn, who is the Vice President for Addictions at the National Council for Behavioral Health, which is basically, I described it to somebody this evening, it's an association of associations. All of us who run associations of mental health and addiction providers get together on a national level and talk about public policy as well. And Becky is the Vice President of Addictions and is Chief Ringleader, I guess, for that group out of Washington, D.C. She's actually going to be helping us all get together in Texas next week. All of the association executives from all over the country will be meeting, and she puts together that meeting and sets the policy tone for a lot of what we discuss. We really appreciate her advocacy and her ability to help guide us around national and public policy issues, and I think you'll find her to be very informative and a lot of fun to get to know. Thank you, Becky.
No, thank you. I love any opportunity to come to Tennessee. I told Mary Lyndon, anytime, just call me. First of all, you can tell that I'm from Georgia, so it's nice to find a place that knows how to cook southern green beans. I have not been able to find that in D.C., and so that was really exciting, and right down to my glass of iced tea. It's amazing how you can mess that up. And so I really appreciate it, and Mary Lyndon's leadership is phenomenal for you guys. I hope you really recognize what a gem you have here, and I can tell you from working all over the country with states and providers that there is a direct correlation between a strong provider association and what happens in terms of quality services for people and public policies that break down barriers and make sure people have access. So it's great to see what's happening here in Tennessee. I have a special place for Tennessee because while I grew up in Atlanta, we spent every summer going to the Delosier family reunion in Sevier County. And so Dolly Parton is not the only famous person from Sevierville. Just ask any Delosier who still lives over there. So anyway, and actually my daughter went to school at Rhodes College in Memphis, so I got all kinds of connections here. I love to come here. So thank you for having me. I'm hot off the National Recovery Month luncheon that happened today in D.C., and then I ran and caught the plane to be down here. So this is super exciting to me to see all of this that's going on. You know, I was thinking about what to talk about just to bring you greetings, and I want to tell you the story of two mothers. Susan has a 13-year-old son. She started noticing that her son seemed extra thirsty, had unusually itchy skin, and dry mouth. She found helpful information on the web based on his symptoms. She posted her concerns on Facebook. Some of her friends offered her ideas from their own experiences, and she suspected that maybe he might have diabetes. She took him to their primary care doctor, who immediately knew the proper procedures for testing and treatment. Her insurance covered the diagnosis, treatment, education, and any needed support to help him. She was devastated that her son was going to have to learn to manage this chronic disease. But her friends rallied around her, offered her empathy, and even shared stories of their own. She even found an online support group for other mothers in her situation. Pam, on the other hand, has a 15-year-old daughter. Pam notices that her daughter is becoming less and less interested in school and her appearance. She rarely brings friends home anymore. They seem to be fighting a whole lot more between the two of them. Pam chalks it up to her daughter's age and raging hormones and all of that good stuff. But things get progressively worse. Pam begins to wonder if maybe her daughter might be using drugs. But she can't talk to her friends about it. Kids using drugs come from bad parents and dysfunctional families. Googling the topic only confuses her more. She takes her daughter to the pediatrician. She even pulls the pediatrician aside and says, "I'm suspicious, I'm wondering if my daughter might be using drugs." Her pediatrician hasn't been trained in how to recognize those kind of symptoms and actually has very few resources to offer. By now, her daughter is in crisis, has moved from abuse to addiction. Her insurance is confusing. She can't figure out if it covers anything, and even who providers she could go to for help. She doesn't know what she's facing. She doesn't know how to get treatment, and she sure doesn't know how she's going to pay for anything. You know, I want to live in a nation where these two mothers are treated equally, where both have access to information and resources to take care of their children, where both can get timely, high-quality care so that their kids grow up healthy. So how do we get there? Well, I don't have to tell anybody in this room the impact points of addiction. They are broad and diverse. And it's going to take that kind of diverse array of groups paying attention to and taking action on the addiction crisis to bring the experiences of these two mothers closer together. As Mary Lyndon said, I travel the country urging individuals and organizations just like you and yours to commit to 3 core actions. And I'm asking you tonight to think about this. Number 1, advocate, which you do a lot of through your association, but I need everybody to think about. Advocate for, at the federal, state, and local levels to ensure that prevention policies and programs are widespread, addictions are treated with evidence-based practices, treatment is covered with parity, and people in recovery have the support they need, just like other people who have chronic diseases. And that safety nets are made of the finest mesh available to catch people and services not covered by insurance. Number 2, take the lead, as we always end up doing because we're the people who are providing the services and everybody turns to us. But once again, I'm going to ask you to take the lead in educating the broader community about addiction. Proactively reach out to other law enforcement professionals, other healthcare professionals, education, social service folks. Integration and working together is the key to making this happen, but it's hard to do. It's easier to do it by yourself, but not as effective. And number 3, and this is a personal thing that I encourage everybody I run into to take out their insurance card and really look at your benefits. Does it provide the full continuum of care for mental and substance use disorders? Does it have an adequate number of providers in the network to provide services for all populations and using evidence-based modalities? Are the benefits just as robust for these services as they are for the other healthcare services that's covered? And if not, push your insurance company, your insurance commissioner, anybody that'll listen to you, because we have laws that protect people so that they can access these services. But if nobody says anything, nothing happens. National Council members, just like you, work on the front lines in communities all across the country. They bring absolute on-the-ground mental illness and addictions treatment to more than 8 million people a year. Our work supports their efforts and the work of other state provider associations by advocating for stronger laws, by consistently improving the quality of care delivered, and by educating the public with many, many community programs. I bring greetings from the President. I have the proclamation to give to Mary Lyndon from President Obama. Don't panic, I'm not going to read the whole thing. However, it's different this year. And if anybody knows anything about these proclamations, usually all they do is go in and change the date. This one is a little different this year, and I just want to point out a couple of things. It starts with every day millions of Americans prove that recovery from alcohol and substance use disorders is possible, yet at the same time, millions more are struggling with the disease of addiction. It goes on to say substance use disorder, commonly known as addiction, is a disease of the brain, and many misconceptions surrounding it have contributed to harmful stigmas that can prevent individuals from seeking treatment they need. These are new sentences this year in the proclamation. It goes on to say this disease can touch any American in any community, and my administration has made combating substance use disorders a priority. And then during National Alcohol and Drug Addiction Recovery Month, let us thank healthcare professionals, support groups, and all those dedicated to helping individuals in need find assistance and reclaim their lives. Let us continue working to address substance use disorders in our communities and promote the health, safety, and prosperity of the American people. And it goes on to sign by our president. So I will leave that with Mary Linden. You know what? You are absolutely my heroes. Your passion is shining and lighting up this room. So I want to thank you in advance for what you do and what you will continue to do to make it a reality that when people need services, they can access quality services and lead a life that is deserving of them and their families. Thank you so much.